Most people think of itching as a minor annoyance, dry skin, allergies, or something easily fixed with lotion. But for older adults, especially those over 60, certain types of itching can actually be your body's quiet warning of something much more serious, including cancer. This isn't about causing fear. It's about raising awareness and helping you catch silent signals before they become harder to treat. In this video, we'll explore 5 specific areas where persistent itching may signal internal illness, including several types of cancer that often show no obvious symptoms early on. You'll learn where to watch, what it could mean, and how to tell the difference between a passing irritation and something that needs medical attention. Let's start with the first sign. Sign 1. Persistent itching on the lower legs. If you've noticed an ongoing itch on your lower legs, especially the front of your shins or calves, and there's no rash, dryness, or clear reason, it may be more than just aging skin. This particular symptom has been linked in many cases to blood cancers like lymphoma. This type of itch doesn't come and go. It lingers for weeks or months, often worsening at night. Lotion doesn't help much, and the skin may appear completely normal. The reason? Blood cancers like Hodgkin's lymphoma affect the immune system. As abnormal cells grow, they release chemicals into the bloodstream that irritate nerves, often leading to this deep burning itch in the legs. There was a case of a man in his 70s who dealt with this exact symptom. His skin looked fine, and doctors first thought it was eczema. But blood tests showed irregular white cell levels, and scans later confirmed lymphoma. That leg itch was his only warning sign. Of course, not every itchy leg means cancer. But if there's no obvious cause, no new detergent, bug bites, or skin condition, and it continues for weeks without relief, it's worth checking with your doctor, especially if it comes with night sweats, fatigue, or unexplained weight loss. Sign 2. Itching between the shoulder blades. An itch right between the shoulder blades, deep in the upper back, is often overlooked. But in some seniors, this symptom has been linked to pancreatic cancer, especially when it's persistent and hard to soothe. Why the back? Because as tumors grow in the pancreas, they can block the bile ducts. This causes bile salts to build up in the bloodstream, and one of their earliest effects is nerve irritation in the skin, especially in the upper back. If the itching is in the same place day after day, feels like it's under the skin, and doesn't improve with skincare, it's worth investigating, particularly if it comes with fatigue, dark urine, or light-colored stools. Your body speaks in patterns. If the itch is focused, deep, and unrelenting, it may be time to listen. Sign 3. Itchy scalp without dandruff or flakes. Most people chalk up an itchy scalp to dry skin or a shampoo that doesn't suit them. But when the scalp itches persistently and there are no visible flakes, redness, or dandruff, it could be something more serious, like leukemia or even skin cancer on the scalp. What makes this type of itch different? It tends to feel like a tingling or burning kind, not just surface dryness. It may move around slightly but stays on the scalp, and it doesn't respond to anti-dandruff shampoos, scalp oils, or home remedies. This sensation is often caused by nerve irritation. When leukemia cells begin to affect immune and inflammatory responses, the skin, especially on the scalp, can start to react even before other symptoms appear. In one case, a man in his early 70s noticed his scalp itching every afternoon. He tried switching products, thought his hat was causing it, but nothing helped. Blood tests later revealed unusually high white cell counts, and he was diagnosed with early-stage leukemia. That itch was his only clue. It's also worth noting that skin cancers on the scalp, especially where hair is thinning, can also begin as a persistent itch or a small patch of irritated skin. These patches might feel slightly raised or rough, but go unnoticed if not directly looked at. If the itch lingers for weeks, stays in the same area, and doesn't improve with treatment, it's time to have your doctor or dermatologist examine your scalp, or ask someone to help check it for you. Sign 4. Itching around the chest or breast area. An itch around the nipple, upper chest, or just beneath the breast, with or without a rash, can sometimes be an early indicator of inflammatory breast cancer or breast area tumors, even when there's no lump present. This itch is often focused, may come with a warm or tight feeling, and may even feel like a subtle burning. The skin may look slightly thickened or have a reddish tone, But in many cases, there are no visible changes, just that persistent irritation. One woman in her late 60s said the itch felt like it came from just under the skin. She changed bras, tried new detergents, even stopped wearing one for a while. Nothing helped. A routine exam revealed a small but aggressive tumor pressing close to the skin. That itch had been the first sign. Men should pay attention too. While male breast cancer is rare, it happens. A focused itch near the nipple or a patch of unusual skin shouldn't be ignored, especially if it's always in the same spot and doesn't improve. Now we move on to a more sensitive topic, but one that's just as important. Certain types of persistent itching in intimate areas may feel too personal to bring up, but they can signal something serious beneath the surface. This is not about embarrassment, it's about health and sometimes survival. Sign 5. Chronic itching in the anal or genital region. Itching in the anal or genital area is often dismissed or self-treated. People assume it's due to dryness, irritation from clothing, hygiene issues, or incontinence products. And in many cases, that's true. But when this itching doesn't go away and doesn't respond to treatment, it may be a red flag for certain types of cancer. In seniors, this could point to anal cancer, vulvar cancer, or even penile cancer. These cancers often start quietly, and itching can be one of their earliest symptoms, long before pain, lumps, or other signs appear. The itch may be localized, often on one side or in a specific spot. It can be described as burning, raw, or irritated, even when there's no visible rash or lesion. People try everything, creams, powders, diet changes, but it keeps coming back. A 76-year-old man thought he was dealing with hemorrhoids. After months of using over-the-counter remedies, a specialist found a small lesion inside the anal canal. It turned out to be early-stage cancer, detected just in time. Women face a similar risk. Vulvar cancer, though rare, becomes more common with age. It often begins as a persistent itch, not as a visible lump. The skin may look slightly discolored or thin, but many women chalk it up to age or postmenopausal dryness. This part of the body is loaded with nerve endings, and it's often the first place to register changes happening deeper in the body, like inflammation, swelling, or unusual cell growth. Don't ignore it just because it's private, and don't let shame stop you from seeking help. If the itch lasts more than 2 weeks, doesn't respond to basic care, and especially if it's always in the same area, see your doctor. A simple exam could provide peace of mind or catch something important before it becomes serious. The bottom line, your body is trying to get your attention. Even if the symptom feels minor or awkward, it's worth taking seriously. Because cancer that's caught early is often treatable. And something as small as an itch could be your first and only chance to act. These signs may seem unrelated at first glance. Legs, scalp, back, chest, intimate areas. But what unites them is persistence and resistance to treatment. If something keeps bothering you and nothing seems to fix it, it's time to take the next step and investigate further. As we wrap up, there's one core message to remember. The body always communicates, often in whispers before it ever raises its voice. And in older adults, those whispers can take the form of something as simple as a persistent itch. The 5 areas we've covered, the lower legs, upper back, scalp, chest or breast, and the anal or genital region, are not just random places. They're patterns that doctors, researchers, and cancer survivors have seen repeat again and again. These spots are often the first to react when something's wrong inside the body, particularly when it comes to certain cancers like lymphoma, pancreatic cancer, breast cancer, and skin or genital cancers. Why this matters for seniors. Aging doesn't just change the body, it changes the way the body expresses distress. Seniors often don't feel the same sharp pain or see the same clear signs that younger people do. Instead, the symptoms can be vague, subtle, and easy to explain away. This is why itching that doesn't go away or doesn't respond to treatment is so important to pay attention to. It might be a signal from your nervous system, a response to inflammation or blocked drainage, a sign that something deep inside is pressing, growing, or reacting. And while these symptoms don't always mean cancer, they do always mean your body is asking you to investigate. Notice the patterns. Is the itching in one spot? Has it lasted more than 2 weeks? Does it keep returning? Check for other signs. Fatigue, unexplained weight loss, night sweats, or skin changes can provide important context. Talk to a healthcare provider. Don't try to diagnose yourself. Bring it up, even if it feels minor or awkward. Document your symptoms. Note when the itching started, how it feels, what you've tried, and if anything makes it better or worse. This isn't a message of fear. It's a message of awareness and empowerment. Cancer doesn't always begin with pain or lumps. Sometimes the first symptom is just an itch that refuses to go away. And the earlier you recognize that signal, the better your chances of getting answers and taking control of your health. So whether it's for yourself, a parent, or someone you care for, pay attention to the skin, not just what you see, but what you feel. Because those sensations matter. And in many cases, they're the first chapter in a story that still has time to be rewritten. Thank you for watching and staying informed. If you found this helpful, please like, share, and subscribe to our channel. And if you've experienced any of these symptoms, feel free to share in the comments below. Your story could help someone else take that first important step. Stay aware, stay strong, and remember, your body is always speaking. Listen closely.